Just 2 years ago, the Harnett County School District decided it needed to improve the way they delivered mental health services to their students in need. It was in response to a rising number of children who needed help but had no access to these critical services outside the school walls.
We saw it in the hallways where there were kids that would be having a panic attack, or there were kids who would hide in the bathroom and be scared to go to class, or there would be other outward signs that we would see where there would be kids really struggling with interactions with peers.
Go.
Barriers to care included either a student's lack of insurance or a parent being unable to take off work and bring their child to a counselor.
Our teachers and our staff did what they could to support students. However, they're not trained in addressing mental health concerns.
That year, Coppola and a colleague visited next door Lee County, which had built a system-wide team to handle mental health issues internally.
We were lucky, fortunate, blessed to be able to have 2 social workers at the time that qualified to be able to provide these services. And so the quickest thing to do was to convert their positions into mental health specialist positions. Didn't cost me any more money to do it. And so they stayed within the budget that they were already being paid from, so that was super easy.
So what are we going to do?
The new system means that social workers and counselors can be on site and directly help students who may be in need and make referrals for others following a parent's consent.
It is a little bit scary, and mental health has a stigma, and people don't really like to talk about it. And so once we started opening that door and talking about mental health and educating people about mental health, we got more and more buy-in because teachers see the benefit of supporting our students.
Counselors say that changes like this aren't as difficult as some may think, and say being on site provides a suite of services critical not to just their students' mental health, but to their education as well.
Figure out what needs to be done, talk to leadership, get them involved, because it has made such a huge impact. And we're firm believers that mental health is health, and we encourage everybody to seek the help that they need. And so I would just encourage people to try and to jump all in.